There's nothing in this bill that requires a cost-benefit analysis of the impact of the implementation of this work requirement policy. In trying to provide a fiscal note, our Senate Fiscal Agency's analysis of this bill says, it is not possible to provide anything approaching a precise estimate of cost and savings. As a result, this fiscal analysis is vague. But it does estimate that Michigan would incur between $20 and $30 million in new administrative costs per year just to implement the new requirements. Our Senate Fiscal Agency also notes that many people losing Medicaid coverage due to the bill would end up uninsured, but would still seek care, mainly at our local hospitals. This would reverse a trend of declining uncompensated care that has happened in Michigan since Medicaid expansion took effect in April of 2014. From 2013 to 2015, Michigan hospitals saw uncompensated care fall by more than half as a share of their budgets. While the Senate Fiscal Agency does not attempt to quantify the impact on hospitals or state uncompensated care costs, the effects could be significant. The drop in hospital uncompensated care costs since 2013 amounts to $571 million. Reversing even 15% of that decline would cost our local hospitals $85 million annually. Other places in statute right now, we have a requirement that calls for the dissolution of the Healthy Michigan Plan once its costs exceed savings. Colleagues, I would argue that the same should be expected and applied for this work requirement policy. We should be actively looking to see whether and how much this program saves and how much it costs. If work requirements ultimately are not saving the state money, they should be discontinued. And that's what this amendment would do, would call for an evaluation of the program, a cost-benefit analysis, and put a trigger in so that if costs exceed savings, this program would be discontinued. And I encourage my colleagues to support this amendment.